we'll have time to discuss on key issues that are handling the quality of emergency healthcare services and in particular find concrete solutions to improve emergency care in Africa.
The cardboard collar performed as effectively as the commercial collar in immobilizing the neck for our patients. And that means it could be a highly economical solution in resource-limited settings, especially where we know that rigid commercial collars are really expensive in some places, or actually not there at all in those places. However, this also had its limitations because we were using a goniometer to measure, so it was really subjective.
This study is the first of its kind to describe the private EMS characteristics of the EMS scores in South Africa, and it's allowing industry to respond through empirical evidence to the needs of patients treated by the South African EMS. The pre-hospital research agenda should prioritize research addressing preventative and interventional strategies to address morbidity and mortality connected to these conditions.
And therefore, since we don't have all the definitive care available, we might have to use these scoring scores to indicate which patients can be transferred or should be transferred earlier than others. Ladies and gentlemen, apologies again for Dr. Mkonkoli not being here. If there's any questions, I'll be happy to try and answer.
In 2013, the mortality was 44%, and now it's somehow stabilized. Around from 2015 up to now, it's almost stable, around 26-27%. And I think always there's a good input from emergency department.
Emergency medicine has actually been a leader on, and I hope that we continue to lead on that as a form of assessment, because it helps take the language bit of things and de-emphasize it ever so slightly.
In Rwanda, in our previous study, we noted that 46% of the causes of injuries were road traffic accidents.
And the same thing about emergency care in your country, in Africa. Right now, we have the biggest collection of emergency care providers on the continent. But surprise, the emergency departments are not closed there. Okay. There are patients who are being seen right now. There are patients who are getting emergency care right now. Okay. It's not as good as, let's just say, the West is the best. It's not as good as that. It's not as good as what's in Europe. It's not the best. Okay. But in that emergency department, and that doctor sits in that emergency department, is providing the best care that he can. He's providing the emergency care he knows best how to.
And as everyone says,
So thank you.
all right, guys.